In today's video, we're diving into the classification of dental caries, starting with Black's classification and then moving on to more modern systems like ICDAS and the concept of stages and sites. Dr. G.V. Black developed this classification system to help dentists understand and treat cavities effectively. He divided caries into 6 classes. Class 1 involves caries on the occlusal and vestibular surfaces of posterior teeth, such as molars and premolars. For anterior teeth, like incisors and canines, Class 1 affects the cingulum or the occlusal surfaces. These are areas that are often difficult to clean properly, making them more susceptible to cavities. Class 2. This category involves the proximal surfaces of posterior teeth. Imagine a cavity forming between 2 molars. It's tricky to spot without X-rays, but essential to treat early. Class 3 targets the proximal surfaces of anterior teeth, but without affecting the incisal edge. Think of a small cavity between 2 front teeth. Class 4. Now, if the proximal surface caries extends to include the incisal edge, it's classified as Class 4, as it can affect both aesthetics and function. Class 5. These cavities occur on the cervical third of the facial or lingual surfaces of any tooth. They're often caused by factors like poor brushing technique or acidic erosion. Class 6. Lastly, this class involves the incisal edges of anterior teeth or the cusp tips of posterior teeth. These are less common and typically result from wear or trauma. Modern classifications. While Black's classification remains a cornerstone, modern dentistry has introduced additional systems that consider factors like lesion activity, severity, and patient risk. One such modern system is ICDAS, or the International Caries Detection and Assessment System. ICDAS provides a scale from 0 to 6 to assess the progression of caries. 0. The tooth is completely healthy, with no changes to the enamel. 1. Early enamel lesions, detectable only after drying or visible under certain conditions. 2. The decay is more pronounced. The enamel has visible demineralization that can be seen without drying. 3. Shows localized breakdown or a visible crack of the enamel, but the dentin remains unaffected. 4. Signs of decay extending into the dentin, requiring restorative treatment. 5. Represents a large cavity where the decay has extensively involved the dentin. The cavity is now clearly visible to the naked eye, and a significant portion of the tooth structure may have been destroyed. Finally, 6 is the most severe stage. The decay has extensively damaged the tooth, with more than 50% of the dentin exposed. And the damage might be so severe that root canal treatment or tooth extraction could be required. Modern classifications also take into account the stages and sites of the lesion. Caries can be categorized based on where they occur on the tooth: occlusal, proximal, or cervical, and the severity of the lesion, ranging from reversible as stage 0 to irreversible damage as stage 4.